Hello everyone, I would encourage you to play this cute little cartoon at the beginning. It just makes an important and simple viewpoint on why communication and leadership and being clear and timely are so important. So you have leaders and they communicate all the time. Communication facilitates meaning. So sometimes more frequent communication is needed to say things more than once. Research shows that people have to hear things 7 times before it really takes hold. So frequently, and different ways of communication can also be a method. So making sure that the person sends out an email, they follow it up with additional messages, they follow it up with verbal communication to you directly or in meetings, different methods, but multiple times is more likely to be understood and internalized. Clear communication results in successful healthcare outcomes. We know this because of all of the safety literature that is out there that indicates that failures in clear communication in healthcare team members is often at the root of medical errors for patients. Nurse leaders need to model effective communication. You probably all at one point or another had a leader that was not the best communicator. And so sometimes you take, an approach that you're going to be proactive in going to the leader for communication. And I think that is a great method to work with a leader that is learning or growing or is not the best communicator initially. But for your staff to be good communicators, you yourself have to model those kinds of behaviors. You'll see in your textbook there are numerous definitions, that deal with what is interpersonal communication, nonverbal communication, what is persuasion, what is negotiation, what is bargaining, what is verbal communication. So take a look at all those and just review through those. I think some of the key ones that are important to kind of remember is what is the difference between verbal and nonverbal communication, with the idea that actually nonverbal communication is really paid more attention to by far than what you actually say. So it's how you are going about it in your body language when you actually communicate than the actual words that you're saying. That goes back to previous information about being an authentic leader. If there's a mixed match between your verbal and nonverbal, often people are going to lose trust in the leader because of that. So you have to be cognizant of those specifics. Also, really understanding what is the difference between persuasion, negotiation, and bargaining. Persuasion is really kind of being sort of more of a proactive sales person to kind of talk about the positives and, whether you're using charisma, you're using, quality information, but you're finding some basis by which you can persuade another person in your communication style. Negotiation is often where there is a person that is mediating a situation between either, some point of a document or a contract where you're trying to work between two parties to help negotiate, compromise on both sides, or how to get the best deal or get the best, financial deal. So different tactics in terms of knowing what you need to do to be a good negotiator. And bargaining is similar to that, except bargaining is more I'll give you something specifically if you give me something specifically. So all of those three elements are part of successful communications as a healthcare leader, and knowing when to employ those is best. I mean, is when to employ those different ones is showing that you have mastered some good communication. Communication is affected by internal and external variables. And that goes to say that can be internal and external to the setting. That can be internal to you or external to you as a human being variables. So, in other words, communication is taking place on multiple levels of complexity, and that's what makes it so difficult to measure and to understand and to um, internalize the message sometimes, is there's so many things that gets in the way. And we really lack standardized instruments in healthcare, although there's been a focus to try to develop more of those in the most recent years, so that when I report a patient to you, I'm covering the exact same thing as you're going to cover with the next person, is a good example of that. But frequently, we just don't have those kinds of tools, instruments, forms, formats all developed in a way that's really clear. So when you think about it, you being the center of communication, your thoughts, your feelings, your perceptions, your values, things that are internal to you, uh, previous experiences, your educational level, the roles that you're in at the time or roles you've held in the past, your own skill set and abilities, your gender, your genetics, your culture, your upbringing, your history, your personality, your voice, your presentation style, all of these elements have an impact on how successful you are in leading people and communicating within a group. When you think about body language, facial expression, eye contact, demeanor, and behavior, these are all things that are under your control. But sometimes we don't always recognize what we do when we're communicating. So it's important when you have important things to share, practice a little bit. Look at yourself in the mirror. What are you saying? We do have the ability to learn from what we're doing as long as we make ourselves to put ourselves in a position where we're aware. Situation or circumstances hit us in the middle of a day or a week or a month, and sometimes we don't have the time that we need to communicate everything effectively. Things beyond our control are influencing how well we do those things. And then there are other external factors that just are totally out of our control, because part of what's being communicated is coming from another source. You may not understand it clearly yourself. You may not be communicating it the best. You may have your own angst about something, so you're not communicating it effectively. So lots of things can influence the way you communicate things or how a nurse leader communicates things. These are just some things related to body language. I would encourage you to listen to this a little bit more on YouTube if you have a chance. But someone that's sitting cross-armed, very closed, sitting too close to another person, can feel like their space is being invaded, and their perception may be that this person is angry or too, uh, pushing me. One person gave an example one time about they happened to get on an elevator with an employee that they'd been having an issue with, and they made a comment about something related to some of the things they were working on in an elevator with just them two in an elevator by themselves. the employee's perception was they trapped me in an elevator to talk to me about this. So you have to think about not just how you're coming across with things, but really plan in advance types of settings and methods that will ensure that the message is well received, understood, clear, and not confused by body language, um, spatial distancing, facial expressions. These are some good things that are used in healthcare. You've probably seen these before. Um, Team Steps has some great things that it's like a training program that a lot of hospitals do. And they have these certain little things that are like scripted ways to do effective communication. For example, if you had an issue and you felt a physician or another caregiver was doing something that you thought was not going to be effective or was not safe, they say use the cuss method and say, I'm concerned, I'm uncomfortable, this is a safety issue for me. Can we discuss this further? As a method of, and for the person that's on the other end, when they hear that CUS kind of coming across in this acronym, that's when they stop and think, wait a minute, they're using the standard language to stop. So let's stop and see what the issue is, and have the dedication as a team to really adhere to those edicts. Evidence-based communication, there are some methods that they can actually review and use some scales to determine what is the nursing leadership like, what is the work environment, and you all have been exposed to motivational interviewing already. So there are some very key structured things that we know that some research has been done on that gives good results to know whether what we're doing is working well or not, or giving us some methodology to follow to really do communication in a correct and researched way that we know will get the same outcomes. Transformational leadership is a type of leadership in which the leader is meant to transform a setting, whether that's, take it to the next level, change the values and beliefs, be looking kind of transformationally, like towards growth of a service line. And to do that effectively, these people have to be really good at developing rapport with people in an easy method. They have to be able to share their vision of where we're going in a clear way. They need to share the decision making about how we get there with the team and get their input, and then really provide constructive feedback as you make these transformations. And then at the end, making sure that you're really doing the feedback method of communicating whatever positive movement we've made towards the goal or the outcomes, and keeping people up to date on that transformation in an ongoing way. One key thing is to listen more than talk. Be open to new ideas. Don't shut somebody down just because you think it's something that won't work. Have them expand on what they're talking about more and listen more. Creating a culture of safety, transparency, and empathy is good. Making sure that you really know how to do that well is important. Another thing that has become a important piece is really looking at spirituality in nursing. We have to document spiritual care these days, and I don't mean what church do you go to. I mean interventions that are spiritual in nature. And while that doesn't maybe fit with everybody's mindset, we have to respect all persons and their beliefs. whether they are a highly spiritual person or they're not. But looking at what will help someone's spirit or their spiritual life is an example of good communication leadership, because you have to be very open to what that inner person is like and what they value to be able to move people and meet those needs that they have. To have great communication, we have to be very, very clear that we will not tolerate bullying or incivility. Nursing historically has been uh, accused of eating our young, basically meaning that when new people come into the workforce, we're too strict on them, to think they're going to not be able to accomplish things. And instead, we need to do just the opposite of that. We need to take them in and ensure their success instead of try to trick them to fail or watch their every move like they're going to fail without cause. And, really determining what is civil behavior and what is incivility, and making that very clear as a leader in what you won't tolerate, and you will take care of it if people have those kinds of behaviors. There needs to be an investigation and if need be, teaching or coaching until you get to the right level of communication that's needed. Then your book talks a little bit about nonviolent communication, making sure that you're making an observation, but you're not being accusatory. You're expressing a feeling like, this is what I feel about something. Here's what I need. In other words, making your request without being demanding or strict or reactive. And just keeping a very nonviolent communication mindset at all times. You guys are going to be forming groups and doing some group work over the rest of the semester, and I would encourage you to watch this video about forming, storming, norming, and performing. Tuckman believed that these were the phases that a work group that's coming together for a specific task will go through. First you're in the forming stage, trying to kind of figure out what are we doing and who's going to be doing what. And then as the group works on different projects or assignments, they start having some conflict, some getting to know boundaries, making sure that everybody's equally heard. And then finally, they move to a stage of norming, to where they're more accepting of the products of the work and the things they've got to get done. And they start to begin to figure out an effective strategy as a group. And finally, once that norming takes place, then they really begin to have some performance excellence and really get some things accomplished. Team steps is here just another mention of it. And it just kind of focuses on tools that enhance performance and safety, because its focus is on safety. I would anticipate that several of you, if not probably 50% of you, when you go to work in a hospital, will have some type of session about team steps, because many hospitals have adopted this as part of their strategy for enhancing patient safety. Here's just another thing that has been done by the Agency for Healthcare Research and Quality sometimes back, and it's like a conceptual model for the team steps. So maybe those of you that kind of like look at it like you have to have knowledge, and you can have knowledge, but if you don't have good communication and mutual support, you're not necessarily going to get to performance. You got to deal with attitudes also that may be influencing this internal working of the patient care team. And so just kind of looking at it from different aspects. You all have heard of S-bar. Some people use S-bar as just a how do I structure when I've got to call a doctor with something. But I would encourage you to think about that, even in your reflections after you've worked. What was the situation? What was the background? What did I assess? Was there anything else I should have assessed? I made a recommendation, but could I have done that in a more robust manner? Was there something else I left out and I shouldn't the next time this type of situation occurs? Huddles. People use huddles these days at the beginning of shifts, sometimes mid-shift. You may see some of that take place. And it's just a way of really staying in touch with key elements for the workday and ensuring that good communication is taking place all throughout the day. This is another 8-stage process that is used for creating major change. And I'll let you review some of these in the textbook as well. But you would think that, like, oh, I have to do a change on my unit as a leader, that I just need to just do it and it comes to people automatically. But it really doesn't. People have to really think about, sit down and kind of strategize about, maybe not pick a model every single time, but familiarize yourself with models enough to know, if I've got a big strategic plan thing that we have to accomplish, I want to make sure that I'm using these tools to make sure that I've got things well planned out and I'm doing it in a way that is going to be successful, because that's what your role is. So we don't anticipate you guys are going to be taking out Cotter's 8 stages to kind of work through a process, but just realizing that there are different ways, and you will have some questions on some things that you'll have a study guide or things to go by to look at this, but just be prepared that you want to have at least some exposure to these different methods you can use. Current issues and trends, having acceptance of others' values and capabilities, and letting people perform and be the one to communicate. If they're the knowledge expert or they're the best change agent, accepting of people's capabilities in a team is very important. And it really helps with at best communication when we can accept different models for doing these things and accept individuals for who they are, which goes along with diversity and inclusion. And people may not communicate at all in the same ways from different cultural backgrounds, religious backgrounds, different ethnic backgrounds, different generational ages. So it's important to really think about, gender differences, all these things in terms of, making ourselves the most aware as nurse professionals on best ways to be a leader and communicate effectively. Here are some other models that are just in there in terms of teaching communication. I won't go over all of those, but you can look some of those up in your book. Another thing with communication issues to always keep in mind is, patient privacy, and how do we navigate that when we have people who are not really on the list to receive communication, but continually come and ask us for information. And how do we safeguard patient privacy just in general practices as a team of people working together? How do we safeguard written communication? Electronic communication and social media are also big topics. These are just a couple of little quiz questions at the end.